Let's hit it.
Hi everyone, and welcome to Alzheimer Speaks Radio. I'm your host, Lori La Bey, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
All right, here we go. What you think about, you will bring about.
And welcome back to Alzheimer Speaks Radio. If you enjoyed our opening song, it's called Clarion Call by the Mark Arneson Band, featuring My Adore, and you can download it on any of your favorite music apps. For those of you that are new to Alzheimer Speaks Radio, I'm Lori La Bey, the host and founder, and I created Alzheimer Speaks to connect us. As a daughter with a mom who lived with dementia for 30 years, I felt a great disconnection to services, products, and tools. And so Alzheimer Speaks is about sound information, not just sound bites. We want to have a real conversation, raising all voices all around the world at all different levels. I also have to thank our listeners. You guys are wonderful. Your likes, your clicks, and shares have just expanded our platform so much. I can't even tell you how. It's just been amazing, and I so appreciate all that you do. In those few seconds of those likes, those clicks, and shares, it really is making a big difference. I want to give a shout out to Coral Health, because they are giving away their Music First and Coral Faith Free during the COVID-19. So you can just go to Coral, and that's CORO health.com to get more information. And then, of course, I always have to give a shout out to the Memory Cafe directory. They just do such a wonderful job connecting people. And now they have a Cafe Connect section, which highlights the virtual cafes around the country. So a cafe doesn't have to be in your backyard anymore, and you don't have to leave your house if you don't want to. So with that, let's introduce you to our guests. Well, I am so excited today to have our COVID panel guests. They come from a wide variety of services and perspectives, and I know we're going to learn a lot from each of them. So I'm going to have each introduce themselves. And Susan, I'm going to start with you, if you don't mind, introducing yourself.
Okay, my name's Susan Mccauley. I'm in Ontario, Canada. And I'm a dementia care advocate. I also cared for my mom for a number of years, between 2005 and 2016. She was in long-term care for 4 years at the end of her life. And I saw a lot of things that I think need to be changed. So I became an advocate activist, and I write a blog called myalzheimersstory.com.
Wonderful. Thank you. And then Holly, I'm going to have you introduce yourself next, if you don't mind.
Sure. Hi, my name is Holly Eide. I'm with HealthStar Home Health. We are a home care agency that is based in Minnesota. We have 10 branches there. We also have 2 in New Mexico. And 4 years ago, I left Minnesota to open our 13th branch, which is based out of the Phoenix, Arizona location. And then we also provide not only dementia assistance, but we do provide assistance for skilled nursing, IV. We also provide behavioral health and mental services for individuals, and we're getting ready to start hospice as well in Minnesota.
Wonderful. Thank you. And then Geoffrey, I'm going to have you go ahead and introduce yourself, if you don't mind.
Hello, I'm Geoffrey Brown. I'm a hospice care consultant for Brighton Hospice here in the Twin Cities of Minnesota. I've actually been in the senior services industry for a little more than 8 years. I have worked with memory care and assisted living, and personally, I've had a couple of different grandparents who have had dementia, and so I helped with their housing needs as well. So I've worked kind of across the board now in housing and hospice. So helping seniors find the services they need and live safe, comfortable lives that's kind of my everyday.
Okay. Have you been touched with family or friends? I know you mentioned about dementia, but by COVID at all?
Yeah, actually, my mom was diagnosed with COVID. She had a bout of pneumonia in January before everything kind of came down, and we think that might have been. And then in March, she was actually diagnosed with COVID because she had a resurgence of that pneumonia. And the lucky thing was she's in a high risk category for being in her 70s. So her doctors really pretty much instantaneously got her on a pretty robust regimen of medications. And so she's doing great. So
Wonderful. Thank
yeah.
you. Holly, how about you? Have you had any dementia in your family or circle of friends? And same with COVID.
Yeah, I actually had an aunt of mine that had a very quick onset. It was kind of scary being that you're in the industry and you know the signs and symptoms to look for, but then we had other individuals in the family who were kind of hiding some of the symptoms that we just didn't catch on to. And so there was a time where she unfortunately had injured herself while she was at home, and that led to her having a stint in the hospital, and then we just saw a very fast progression. Of course, at that time, then we were able to witness it and had to move swiftly in order to get her out of home and into a safe facility. But then as far as COVID, yes, unfortunately, being in the home care industry, we've had several individuals. There's a much faster outbreak taking place right now in New Mexico. Just because we do service areas of the Native American population. And so the reservation right now is seeing a very fast uptick in growth. In Arizona, we've only seen a handful, so we've been doing a little bit better here. It seems like to me, and what we've seen both in Minnesota, Arizona, and New Mexico, some more of family members who live together or have that more communal type living. Unfortunately, that's where we're seeing things spread a little more quickly. So we've seen it. We've seen people definitely get through it. We've also, of course, unfortunately, had some clients who have passed from it as well.
Great, thank you. And Susan, how about you?
I haven't been directly affected, and I don't know anyone personally who has been either sick or diagnosed. But I live in a small town just outside of our capital, and we have 3 long-term care facilities. And in one of them, one of the smallest one, they have, I think, about 80 patients or 80 residents, and 30 have died. So that was a lot, and it has really affected the town. The town itself is only 5,000, population 5,000, so it's very small. And so I've been doing a lot of advocating around that, and the province that I live in is also one of the worst impacted. And I think we need to be doing the problem is, or part of the problem is, that there were lots of issues in long-term care that were exacerbated by this pandemic, and it's exposed, all the cracks in the system have suddenly become canyons. And there's been a lot of deaths, a lot of illnesses in residents and in workers as well.
Okay. I want to get into kind of dive in a little deeper because of your advocacy and stuff in terms of what you're seeing, and you explained the numbers and stuff, but how is it affecting people, the residents, the staff, the community at large? Do you see changes taking place to compensate for COVID, entering our world?
Well, I think that people who have not been exposed themselves to long-term care, or who haven't had a parent or a relative or whatever in care, have been shocked at the conditions that have been found as a result of this pandemic. And so I think that my hope is that in the short term, there's going to be a lot of action taken as a result of what's happened. And in the long term, I hope that the whole system is rebuilt, because it's clearly not working the way it is. And when you have a disease like this, it just spreads like wildfire. And so there's been a lot of reaction within the community, within my small community, within also the province, and also the country at large. So there's a lot of awareness that's resulted, which is a good thing. And let's see now if there's any change forthcoming. That's a different story. You know, maybe it'll be flavor of the month and then nothing will happen.
Yeah, that minor detail of let's actually move forward and not just chit chat about it. What about, you know, you're a blogger. What kind of response are you hearing from your community there?
I think that, well, what I found is that my traffic on my blog is gone down quite a bit. I think people are busy just trying to survive, and they don't really have as much time, although one would think that they might, because everybody's here, we're still on lockdown. So it's only essential services working. And but a lot of my traffic comes from the States. So maybe you guys have more availability down there in terms of free time. But the traffic on my blog is down a little bit. And I think people are just trying to, you know, do whatever it takes to survive day to day.
Yeah, I think there's a lot of distractions and people getting pulled in different things and changing rules constantly. So people are, you know, they're just constantly adjusting. Am I going to work? Am I not going to work? Do my kids go to daycare? You know, can we leave the house? How do I get my grocery? I mean, it's just, it's constantly changing. And then when you have healthcare needs on top of it, one of the things that I've seen is that there is a lot more available on, you know, virtually, but it's not communicated well. And so people don't know where to go anymore. So it's almost like pop-up sales for educational pieces and things like that. And they haven't really formulated and drawn, and I'll say kind of communities really leveraged that. I've seen a lot of communities not necessarily engaging their families right now, and they're screaming for that. And so it'll be interesting what others see with that. But very few do I see doing a real robust program in terms of maintaining even who's on their wait list, families that are currently with them right now, and then educating them through the process so that they feel like there's support. And I personally, I've been screaming this for months, but I think people have to get on board with a really robust program, because people are going to be more hesitant about placing. Some people have been pulling people out, and I think there's a need to meld all of those services together so they feel like they're part of a family that's going to support them. Not that they're just placing a loved one, but they're getting served too. In the process. I think that's really bubbled to the top in my mind.
Well, there have been that many deaths in long-term care. I think in Quebec, which is the province next to where I am, 80% of the COVID-related deaths have been in long-term care. So people are, I think people are afraid. Lots of people wanted to take their loved ones out of care, bring them home, take care of them at home. And either they weren't allowed to do that, or it was problematic, or they were told if you take your person out, you won't be able to get your person back in again because there's long waiting lists. And I mean, the whole thing is just a disaster.
Yep. Well, and I think some family members don't understand that, they placed a loved one for a reason. That reason probably hasn't gone away. It's probably escalated, and they're not seeing all those signs because they're not there 24/7. And I've had families go, well, hire someone. And I'm like, good luck with that. Because, the businesses are having a hard time finding staff. themselves, and being healthy, or thinking about little things about, well, now if I'm going out to get groceries, can they stay home alone, or now am I taking them out in the community with me? I mean, there's so many levels, I think, that we have to help people slow down and process all of those things, and then be able to tap into the services that not only their loved one needs, but they need to maneuver through this. And I just don't think, I mean, I think it's great that, people are doing window visits, and it makes me cry every time I drive by and see one. And I think, oh, that's got to be so difficult. And I think it's great that there's FaceTiming and things like that going on, but it doesn't replace for many individuals, especially couples that visit every single day. And we're seeing the depression, we're seeing the changes in not only the person with dementia from the isolation and the change in routine, but also in their loved ones, their care partners, and the fear on all sides. And I think we have to come up with a way to better balance and support that. So thank you for sharing what you're seeing up in Canada there. Holly, how about you? How have you guys had to adjust? I'm assuming that you've had to adjust.
Yeah, we absolutely have. It's been kind of an amazing transition, because when you look at some of the things we've had to deal with in the past, nothing has been on such a grand scale that it requires everybody's effort from all sides. And so, I mean, just from the standpoint of as a community working in the medical field, it's really a challenge to be able to get what you've seen on the news, the PPE, the appropriate masks, the number of pieces of equipment that are necessary in order to keep our clients safe. And so to be able to see this transition from it's me trying to keep my clients safe, it's transitioned into one where how do we as a Medicare or medical community work together? And it's brought so many of us together. We actually now have full committees where everyone's involved. We're sharing information like never before. It's all, I mean, Geoffrey knows this, it's kind of a cutthroat industry at times, and you worry about, if I share information, my client may leave my agency and go someplace else. And we just have seen such a difference in this, where now we're collectively working on, one agency is buying, 100,000 masks. One agency is sourcing hand sanitizer. One agency is working with the county to see what we can get from everything that the government's been trying to help pass out. And so with that, we've utilized our resources in that way, so not one agency is having to try and source all those things, because I can tell you, before this started, I had already started trying to get masks and started getting gloves before there was any shutdown. And before that even happened, I was unable to get some of those. I have one order that's still on back order till August. So it really drove all of us together in a much different capacity to start caring more about what we do and why we're doing what we're doing, and how do we keep our clients safest. There's been so much education around this. We've shared educational resources. We've worked diligently around the clock to be able to create new ways of training our employees at a faster pace. I mean, Zoom has been, a godsend for a lot of people, but those are some of the things that we've had to change. We've had to look at how do we source equipment when it's not available. So, you talked about Susan talked about whether or not someone should take their family member out of a facility. Although that may feel like the safe thing to do, the reality is I've seen so many different facilities and how they've stepped up. I was on a call just this week with a facility here in Phoenix, and they had, out of a 70-bed facility, they had 11 individuals become sick. And they talked about prior to COVID, they never would have suspected that these people had anything other than a few symptoms. They only presented with a fever and with exhaustion. And they said there, normally we would have just given them fluids and asked them to rest. But due to COVID, they've done so many other things. They've been able to actually get people healthy. And because they've done the training and the prep, they've been able to slow the number of people that would have been sick because they stopped families from coming in. And I know that's really hard to hear, but from this side, on the medical side, talking to people who are firsthand on the front line working in those facilities, talking to our own people who go in and out of a home, we can honestly see that the families who are staying together are causing more harm because they aren't trained the way that they should be in proper protocol for PPE. How to really wash your hands, how to really put a mask on and off so that you're not, infecting others. If you, get into that person's space, that air space, what should you be doing and watching for? So in some ways, although the distancing has caused a lot of issues, I do believe from what I've heard and from what I've personally experienced, we are doing a better job than we would have done had those family members not stayed where they were, had they not have distanced the way that we started distancing. So I do think that there's a lot that has changed. And we've had to maneuver really quickly when it comes to no masks. We've had to follow CDC guidelines, but even they are going through something they've never experienced before. What do we do when we don't have a mask? Well, we've had to come up with other solutions, and some of those solutions become what we call a round robin, where we're issuing our caregivers masks. They're required to wear them in the home. They're required to wash their hands upon entry. Once they've, gotten inside, they either have to wash their hands or use hand sanitizer, and we ask them to do that in the sight of the client. We want them to visibly see us performing those extra necessary steps. And then, of course, upon exit, the same thing. But depending on whether a client is COVID positive or whether they're showing symptoms, all of that has changed a lot. We now require caregivers to call ahead of time or stand 6 feet away before entry and doing a symptom check before they ever enter the home. Because if an individual is sick or is showing symptoms, we need to take necessary precautions and not just walk into the home. So we're doing that consistently before every single visit, doing the symptom questionnaire. If there's no symptoms, then making sure we're masking and that we're making sure we're washing our hands before entry. So these are all new concepts that in some ways the clients are really, some take it very seriously. Some appreciate it. Some feel like maybe this is, a little too much. So there's just a lot that has changed for us on the home care front.
Yeah, I loved when you talked about the group cooperative purchasing, because I've seen so many companies just so stretched trying to, do everything. And it just makes sense to chop that up and work together because it's so time consuming. And then that cuts down on, raising the price and the bidding wars and all of those types of things too, which are very real out there. And when you were talking about, instituting, kind of these new procedures, I just have to add in my granddaughter was going to preschool, and then they pulled her out, and they've been kind of paying for her placement, going, when's it going to be safe? And she was talking with the gal the other day, and she said, it's kind of weird. We haven't had a cough, a sneeze, a sniffle, a fever, a nothing with these kids, And Charlotte is one that has asthma really bad, my granddaughter. And so she picks up anything really quick. And she's been home, and she really hasn't been sick either because, everything is cleaned and sanitized and wiped. And, everyone's kind of hyper vigilant. So yet there's that miss and that social interaction. And Holly, have you seen an impact on your families or have your staff where now people can't get out? And, is there chatter on that where they're feeling more isolated and alone?
It depends. For the most part, people are choosing to stay home. It's not that they can't go out, they just understand the risks that are associated with it, especially for those who have underlying health conditions already. Individuals who have dementia, that's a whole different, way of looking at things, because now it's will they wear a mask when they go out into public? Will they take that mask off while they're out in public? Will they, allow you to assist with hand washing on the frequency level that they need to, or applying hand sanitizer? So there's a lot of things that go into that, and there's a lot of questions that are raised around it. So most people are choosing to stay home, and we've seen an uptick, of course, in the number of individuals who are also asking caregivers not to come into the home. They just don't want the risk at all. So we've had people step up the amount of care because they're home alone. They don't want to go out and they don't want to do their own shopping. So they've said, no, I want more assistance. I don't want to be exposed. And then we've had others who've said, I only want family members to assist. And, we've had people in the home where the client, unfortunately, unknowingly, had contracted COVID, not even really sure how it happened because she lives alone. Her family had not been visiting prior to the shutdown, and she became COVID positive. We were one of the very first cases here from a lot of the agencies that I've spoken to. We had the first case, had a caregiver in the home who was wearing a mask and was also washing, her hands and that sort of thing. But she ended up being just fine. Unbeknownst to us, she went to 3 other clients within the 3 days after that. And that, of course, is a big scare too. And so nothing happened from that. No one else ever contracted COVID. Everybody stayed healthy. So it's a different way now of being considerate and, knowing whether or not you send a caregiver into only one home, into multiple homes. And then there's also the big question, which is we ask, do you have any fears surrounding this? Are you okay with multiple caregivers, or will you only allow the one person to come into the home consistently? And are you okay with them visiting other clients? Because sometimes they're fine with, a change in caregiver, but I don't want them coming from someone else's home. So there's some fears around that we've had to try and talk through and explain what we do so that people understand there's, protocol in place to protect them. But other than that, we haven't really seen too much on our side, the distancing issue of people not being or feeling isolated. I did hear that in one facility this week. They've been now in isolation for 2.5 months. And for them, the administrators have gone above and beyond to do FaceTiming, window time, Skype. No matter the time of day, they drop what they're doing. They've given all the family members their personal cell phone. And if you need me now or you need to talk now, she drops what she does and she literally goes to the client's room and they do FaceTime right then. So I've seen, the human side of this has switched so much so that people are really trying to stay emotionally connected as much as they possibly can.
Well, and I think that's one of the big benefits to this is that it has brought that compassion to the surface in a lot of ways, and staff have to relate differently. And but it's still hard. Have you had any of the push-pull? Like I know in Minnesota we have this kind of push-pull thing about wearing a mask or not wearing a mask, and then being disrespectful. And I had a friend, for example, who went to go buy a plant at Home Depot, and a 92-year-old woman came up to her in her face and said, "What's wrong with you? What are you wearing a mask for? I'm 92 years old. I'm not scared of this damn virus," she said to her. And it's just kind of bizarre out there. Are you guys seeing that too in Phoenix?
Yeah, we absolutely are. I think one of the biggest things is it's the person's perspective. I've had clients who've said the same thing. Lived through depression, the depression. We made it through the diseases back then and the big pandemics. And unfortunately, some people feel if it's your time to go, no matter whether it's COVID or it's cancer or something else, that's just their mindset. I've got other people who take this very seriously and don't want anyone coming, within that 6 feet distance if they're not wearing a mask. They absolutely just don't want to be close to you, or they have family members at home who are at risk and they don't want to be the one to bring it to them. So I've seen definitely both sides. In the last week that we've been opening up, restaurants, bars, everything now. We're starting to see more and more non-mask wearing people. They still are out there, but not anywhere near where I was seeing 75%, 50% before. Now I'm seeing maybe 25% are wearing them. So it's definitely changed.
Okay. And then how is staffing going for you? Are you having issues trying to secure staff during COVID here?
That was the initial scare, and all of our agencies talked about how we would strategize around that, because there was this large concern that people would say, I'm not going to work anymore because I don't want to be involved with someone who may have COVID. And then there was, how do we address a client who's COVID positive and getting caregivers into the home? And it's been a huge relief for all of us. I have not seen that. We have had in my agency, I want to say we've had 2 or 3 people who've requested to take time off. In New Mexico, much larger population over there that we serve. Same thing over there. We've seen a handful of people. But other than that, by and large, everyone has not only committed to working, but we aren't seeing all the people call in and not go to work. I mean, prior to COVID, we had so many people calling and taking time off, and we were shuffling to reschedule shifts. And right now, everybody's staying consistent. Everyone's showing up. I mean, it's actually been really nice on this side. So no, we haven't experienced that, which has been, like I said, a huge, huge relief for us that have to, try and make those schedules make sense.
Oh, that's fantastic news to hear.
Yeah.
Geoffrey, I can't wait to get to you and hear how things are going with hospice, because, we're hearing, families not being able to get in and communicate. Oh, how is that working for our wonderful hospice workers?
It's been a real challenge, actually. And we've started a new program with some telehealth devices that some of the folks are letting us, some of the facilities are allowing us to use, where it's an actual, if you're familiar with like a Amazon Echo device, this is a show device which has the video element to it. So essentially it's a video conferencing device that allows families to actually be present in the room, kind of at the drop of a hat. It's just as easy as making a phone call. And it's kind of like having a Zoom or a Skype. But the nice thing about it, especially in a memory care setting, is it doesn't take any software knowledge, and the family member can initiate the call, and basically they schedule with the facility workers, the nurses in the facilities, to say at 1 o'clock I'm going to call mom, and so the nurse will go in and make sure the device is on, and that's all they have to do is make sure the device is on, and that way the family member can call in and have some face-to-face time in those facilities where people aren't allowed to visit. Because it's been really interesting here in Minnesota, because it's really facility to facility how people are dealing with the shutdown. Some facilities, some of our facilities that we have relationships with have it's open visitation. So people are allowed to come in and visit with precautions in place. So there's masks. There are, and like Holly was talking about, having interviews and symptom interviews before allowing somebody to come in as a visitor, but they're not super restrictive. Then other facilities are completely restricted on visitors. I, as a consultant, am not allowed to even go in and talk to my referral sources, the nurses that are in the facility. So it's kind of interesting. It really is facility by facility. I mean, the thing is, we have real personal connections between our nurses and their caseload and the patients that they're serving, because we're out there so often. That's kind of one of the things that's so important in this business, is that personal connection. Because in hospice, you're really dealing with folks in end of life care, and so everyone's kind of either in a crisis mode when they're first coming on board, or they're really in that grieving process, getting ready for the end of life. And so those personal connections are so important, and the isolation can be so daunting for people, because we realize now in medicine that isolation is as dangerous as some bacterias, as some viruses, as some other types of illness, and isolation can be as damaging as those types of things. So it's like, one of the things that we're very adamant about at Brighton is making sure that those family connections are honored as they need to be, because we all know in this business that there are family dynamics that happen. And so part of our onboarding process is really learning what that family dynamic is, how involved the family is going to be, how much visitation they want to have. So that's really important for us. I mean, as far as the COVID is going, with end of life care, things have been very much the same and then very different. There are certain elements of it that stay exactly the same, and then other parts of it that are very different. So we're still out there. Our nurses are still out there doing all of their cares and making sure they're making those face-to-face visits, because we're considered essential employees, because their primary caregivers are our nurses and things. So but one of the things we've adjusted is oftentimes the CNAs that are out there, the home health aides that go out, sometimes is on a bit of a rotation, but that has been, we've kind of changed our model, and we're assigning one CNA per building. So a whole facility is getting a dedicated CNA from our team, instead of having, because we might have 12 patients in a building, there might be 2 or 3 CNAs that are going in and out of that building to deal with all those 12 patients. But now we're just trying to help alleviate the concern about cross-contamination by saying this one aide is going to go to this one building, and that's kind of that aide's full-time job, is just to go to that one building. And I was wondering, similar to what you were saying, Lori, and also Susan, is this going to be kind of our new normal? Are we going to learn something from this that makes the model stronger, or is it stronger? Or, because I think about those personal connections, and if you have one CNA in a building who's making all of those personal connections with all of those patients, maybe that is a stronger model. I don't know. I'm not in the management side of that part of it, but that is something. I mean, I don't know. I think we are going to learn a lot from this, just as Susan was saying, but we have a specific COVID team as well. So we have, for the patients who aren't COVID positive, they're seeing their regular nurse and their regular CNA. But if someone is COVID positive, we have a specific team within our team that is dealing just with our COVID patients. So that's added a new element of our onboarding process and our admit process of, when somebody calls and they're saying we're interested in hospice, we have to say, well, have they been tested for COVID? Or it's a little easier when somebody's living in a facility, because most of the folks who are living in facilities have been tested at this point, because our facilities here in Minnesota have been impacted so severely. We have one facility we work with pretty regularly, have a pretty large caseload in, and they had, I want to say 47 folks out of, I think there's 300 that live in the whole facility, AL and long-term care, and 47 of them have passed, and a large portion of those were on our caseload too. So COVID's had a real impact here in Minnesota, and the numbers that they're telling us right now are that it's not going away, that it's gonna we're gonna have another wave that's coming up, that we haven't really hit our peak yet. So in that instance, I mean, our greatest referral sources are the facilities, the assisted living and long-term care facilities. So we work mostly in that setting. We do have a lot of own home patients. That's actually something that's been interesting, is we've had a larger uptick in patients living in their own homes that are calling us, and their family members are calling us. So I don't know, as much as the business has stayed very much the same, and we've just had to shift a little bit of the mechanics of how we do things, like having this COVID specific team and maybe just having one CNA per building, those mechanics have changed a little bit. But on the whole, end of life care has remained the same, especially with our frequency of visits and things like that, is really the only thing that's been impacted. And that's often determined by the facilities, because our standard has always been to have at least 2 nurse visits a week. And some of the facilities have said, that's fine, and you can maintain that schedule. And then other facilities have said, no, you can come once. And the Medicare mandate is once every 14 days. And some facilities have said, no, that's how often you can come. Others have said once a week. So it really is keeping those lines of communication open with the facilities and making sure that they have the control that they need while we're maintaining that level of care and that level of face-to-face interaction with our patients as much as we can.
Well, I like the idea of having like one staff per building, because I think that increases just the knowability of how something functions and the communication levels. And, you know, when things are, I mean, it's like the rugs are being pulled out right and left, you know,
Absolutely.
and
Absolutely.
the puzzle pieces are changing all over. It's much easier to communicate that to one individual than multiple. So I think, well, you know, you'll have less falls in the cracks and stuff there. How are you doing with staffing and stuff? Because I know, like with hospice, when my parents were on, a lot of the staffing was volunteer staff too. And how is that handled? Or are they deemed not essential and can't come?
So Medicare mandates that a certain number of hours every month from a hospice agency have to be done by volunteers, which is why volunteers are so important. Well, that's not why they're important. That's why we have them on. I mean, we have them on board because one of the main functions that volunteers serve is are what we call vigil visits, and towards the very end, when someone's in transitional or actively dying, our volunteers are sometimes our very front line, because family members need to get out and take care of themselves sometime, and they don't want their loved one to be alone. So our vigil volunteers go in and will sit and be that person who's there so that people aren't alone in those end times. So a lot of our volunteers have decided to kind of take a break from volunteering completely naturally. But a lot of our volunteers, because they have to go through the whole process of learning how to use their PPE and to maintain distance and stay safe anyway in hospice, those are always concerns. Some of them are just kind of treating it as business as usual and maintaining their same schedule. So we're having to lean on fewer volunteers to do more visits, but we still have the volunteers and they're still making their visits and still handling bereavement care and things like that as well. But similar to what Holly was saying, we haven't seen a real fall off in staffing. What I have seen in some of the buildings are I've seen some real burnout, because the nurses, because there's so much stress going on, even like Susan was saying, there's such a high percentage of COVID in the facilities, and any kind of communal living is going to have a hard time managing something. I mean, I think about even when something a little less virulent, like norovirus or something, hits one of these facilities, they have to lock things down. And then something that's even this, you know, COVID is so much more severe. It's really stressing out the facilities, because they're having to do the same things we're doing. Several of my buildings have a specific COVID wing. So similar to how we have a specific COVID team, they are shutting down certain areas of their facility and just saying, this is the COVID area of the facility. Let's keep everybody else away from that part of the building. And some are having success with that, and then some aren't having success, even if they've done something like that. So everybody's doing the best they can. But if you think about having a specific wing of your building, you have to then minimize the staff there too, because then if you have multiple staff going in and out of there, then it's not going to be effective. So I've seen some nurses who were getting kind of close to retirement have gone ahead and retired. I've seen some of that happening. And then I've seen some real burnout where nurses are they're stressed to the max. And we as the consultant team at Brighton, we're trying to support them as best we can and make sure they have everything they need and feel supported in this time. I mean, that's our job every day anyway. And we're just trying to go above and beyond right now, just so that they know how appreciated they are in this time. I mean, it's such an essential job. And Susan, I really appreciate what you were saying about really how, and this is something, Lori, I know you talk about a lot, is how our model it's not made. We always talk about person-centered care. Everybody's always talking about person-centered care, but the way we've built the system is not person-centered. What's amazing to me is, and what the blessing of having worked in hospice for the last almost 3 years, the real blessing of it to me is watching these people who have a real passion and a real calling for this specific type of care, because you can preach numbers or, returns of investment or whatever you want to anybody, but hospice people just kind of look at you sideways and they're like, I'm here to serve people. So, I mean, it's a real blessing working in hospice. And I know, Holly, you wouldn't be branching. And I always say this to people too. People don't get into hospice to make money. That's not what they're here for. They're here because they have a passion and a calling for it. And it really is about people. And it really is about making those personal connections and serving a person and making sure they have dignity all the way to the end of their life, because the end of your life is still part of your life.
Yeah, very, very much true. One of the things I wanted to just state is that, you're talking about the video and the technology and things. My mom was actively dying, and I ended up having 2 keynotes in Arizona. And my whole family thought I was having a nervous breakdown because I left. But I knew my mom had said I wasn't going to be around when she died. She needed me gone. Yeah. And she needed them to all experience that process. I was thinking we would talk by phone, and my daughter said, let's do FaceTime. I didn't miss anything because of video, and I want people to hear that really loudly and strongly. Yeah, I was there for last rites. I was there to put my brother in line when no one else would. I was able to guide them, but not physically do it, so they could still experience it. And I would really encourage volunteers to realize that as important as compassionate touch is in hospice, I'm a firm believer in that, just your voice. Yeah. If you are singing a song or reading a story or just chatting and reminiscing, even if they're not responding, those are still, in my opinion, as a daughter, extremely important, and they can still be done long distance with a safety. The other thing that I want to comment on that I think has not been done well in most areas is tapping into a community who wants to help. They want to volunteer, but companies have not tapped that. They haven't told them how to do that. They haven't coordinated it. So I think there's a lot of people out there, if you let them know, you've got these opportunities where they don't have to risk themselves necessarily, their health, but it could be done in other fashions. And then there's others that would be, more than glad to come in and do that visual. But I know it's difficult because everybody's, balancing so many balls at one time. Yep. You actually almost need a coordinator for something like that.
We actually do have volunteer coordinators at Brighton Hospice. So on our website, brightonhospice.com, if I can be so crass as to make a plug.
Oh my gosh.
You can find our, we have a whole section about volunteering and what the different volunteer opportunities are and things like that. So we also have pet volunteers who go in and do kind of, it's not strictly pet therapy because they're not therapists, but the dogs have all gone through training and things like that. They have to be specifically trained. So we do have whole sections devoted to and coordinators strictly for volunteer services.
Great. What about, I know music therapists and stuff used to be able to come in. Are they able to come in at this time or not?
Those are the ones, and that is also facility to facility, but our music therapists who are on staff with Brighton have put together YouTube videos and things like that they are then coordinating with the activities coordinators in the spaces to make sure that our patients are getting so essentially what happens is you make a connection inside the building with the activity coordinator, and they go to the specific room of our specific patient and load up a video and say, here's some music specifically for you and those types of things. So where it's very much the same as we're still making the visits, we're just having to do them completely differently. And that's really, it's the mechanics of the visit are a little bit different, but the frequency hasn't changed.
Yeah, and many are using, especially over in the UK, the MP3 players with playlists and stuff. I mean, I know we have music memories here. Everybody's doing them a little bit different. And I've even done, I haven't done them. I just facilitate. I have facilitated 4 sing-alongs, video-wise that people can do. But I think it's really interesting how people are learning to connect in different ways. And I think it's very empowering to families when they're able to connect, because some of them are like, oh, I did it. I didn't know I could do this, and then this whole world opens up because the fear has alleviated itself, and it was forced on them. They probably wouldn't have done it before, but it was really a door opener. So I think that was a good thing. I also had one gentleman, his wife is in memory care, and he actually set up an iPad in her room that is plugged in on a table.
Mm-hmm.
She doesn't have to turn it on. He can just beam in anytime and talk to her or see her. And he says sometimes she doesn't respond, and that's okay, but he can see her. But with that situation, he bought the equipment, and
Yep.
set it up, and then told the staff just to plug it in, and this is where I want it to be.
Yep.
And that's worked really well. So then staff don't have to be called all the time
Right.
to go in. But again, that's an expense that not everybody is willing to.
That's kind of trying to help some of our patients with our telehealth devices. It's kind of the similar situation, so that it's not, for those who can't afford to make that purchase on their own. Yep.
Great. Anything coming up? Because now on top of COVID, now we have this civil unrest. Any more twists and turns coming in? Because I know down on University Avenue, I was just thinking of, we have, one huge community down there, and I thought they must have been scared to death last night with the sirens and the smoke and the lights. And I just thought, I just can't even imagine.
I was actually over on 38th Avenue 2 days ago, right before the unrest really started. So all the news was going on, but they really hadn't started the protests yet. And I just happened to be over on that side of town, dropping off some marketing materials in the vestibule of a building that they wouldn't let me into. I came back home because I'm working from home mostly. So I make small sojourns out with my mask on. And then all of a sudden, and it really kind of struck me, because I was literally just there. Like a couple of hours ago, I was there, and then all of a sudden, everything started to get kind of crazy over there. So, I mean, I have to say, there is a lot of unrest, but I think the buildings, the buildings that are being destroyed and damaged right now are specific to that area, and I don't think there's there might be some residential facilities over there.
There is on
at
the
least
St.
a couple.
Paul side.
Yeah.
Yeah.
And it's I honestly don't know what to say about
Okay.
I mean, it's a really scary situation, and if I had a loved one in one of those facilities, I don't know how I would react.
Yeah. Well, thank you so much for your comments. Any last comments that you want to make, Geoffrey? Otherwise, I'm going to have you go ahead and we'll give out that contact information.
I think I really appreciated what Susan and Holly were both saying about how we're all, and you as well, Lori, about how we're all learning from this situation. And I always believe in creative solutions to obstacles and challenges that present themselves. And I think we are going to learn a lot about this, and a lot about how much more important certain jobs are than other jobs. And I think starting to honor those. I mean, everybody started coming out and saying hazard pay for healthcare workers. And I'm like, how about reasonable pay for healthcare workers all the time? How about that idea? So that's kind of where I land. I'm always about the creative solutions. And I think we are going to learn a lot from this, and really how to do our jobs more effectively, whatever challenges present themselves.
Great. And then for contact information, people can go to Brighton Hospice.
BrightonHospice.com.
Okay.
Yep. And that's actually for all of our different markets, because we're in 6 different states now. So you can find the Minnesota, Oregon, Wisconsin, Indiana, or Nevada, any of those offices.
Okay. And then do you want to give out a phone number too? Or
Sure. Our main office here in Minnesota is 952-856-2212.
Can you say that one more time?
Sure. 952-856-2212. And that they can get you in touch with any of we have 3 different offices here in Minnesota, in St. Louis Park, and in Lake Elmo, and in Northfield. But that number can direct you to any of those. And it's always answered by a person, even after hours, for our on-call team.
Okay. And I would imagine if they go to the website, there's an email for contact there.
That's correct.
Okay.
Yep.
Wonderful. Well, thank you so much, Geoffrey. Appreciate
Thank you, Lori. I appreciate being on.
Susan, I want to go back to you, and we haven't talked to you for a while, and find out if you have other comments after listening to Holly and Geoffrey.
Yeah, there's something that I want to pick up on that both Holly and Geoffrey kind of talked about, and that is the importance of family members and volunteers. And one of the issues that we've run into here in Canada is that, like other places, family members, one of the first steps that was taken was to ban family members from going into facilities. And I really feel I don't share Holly's view that that's a good idea. I think that family members and volunteers can be trained to wear PPE just like anyone else. They can be trained to distance properly, to do all the proper protocols, and they are essential, in my opinion. They're essential to the care and well-being of residents. And what happened here is that taking those people out of the mix in terms of servicing the residents in long-term care facilities resulted in more people getting more sick and dying, because there were cases where the family members were the ones who were feeding and hydrating the residents, and without having them there, and the staff, of course, they couldn't, as Geoffrey was saying, everyone's stressed. There's not enough workers really to do the work that was required, particularly with the additional burden of COVID. And I really feel strongly that a different approach would have been more efficacious, let's say.
Okay.
So that's my view on that.
No, it's good to hear different opinions. And I think part of, I know what I heard here in Minnesota was, they were trying to limit where people are. Maybe they're trained and they do what they're supposed to when they're there, but what are they doing when they're home? And that makes a difference. I mean, I remember going to a store and everyone was wearing a mask except this one gal who was, she was probably in her 40s, and we got chatting, and here she was a school teacher, and I just thinking, oh, and our kids could be going back to school. I mean, because we didn't know what was going on time-wise, and I was just like, that's interesting. But yet, how do you can't really marshal that, but it's just that whole sense. And I know here in Minnesota and many other places, I mean, it's really, you're either on board with it or you're not. And it just seems like it's a very black and white line, and there's not a lot of consistency. Plus, I think the other problem would be the additional PPE needed when communities are struggling to get that in the first place. I think that was a big
Yeah.
And then I read an article the other day that even with the business loans and stuff, and I don't know if this is true, I read it at a pretty reputable article location, but they were saying they couldn't use those funds for PPE. And I'm like, and I also read that community costs, if they have even just one person with PPE, triples their costs of care in terms of what needs. I mean, there's just so many factors in.
Yeah, lots of variables. So one of the other problems that we've had is that, and it's interesting that Geoffrey should mention that one person would be going to one building. A lot of care workers in Canada, because they're employed on a part-time basis to save money, they need more than one job. So they're working at several different facilities and going from facility to facility, and that's how that's increased the spread. And so there's another factor. And I think some research needs to be done around the impact of family care partners going into facilities and what role they play, how much their input is required, et cetera, et cetera. I mean, we could argue back and forth, but it's just an opinion, isn't it? We don't have any proof as to what difference that people actually make until we measure it.
Yeah. Well, to me, I think there's enough significant difference that people make a huge difference in this
I
realm.
think so too.
And in both from the social side and the social distancing and the washing of the hands and the whole 9 yards. I think we are powerful human beings, but if we're not conscious of why, if we don't really understand, and I think, you know, most families probably feel and would be more diligent because they want to be there because of their loved ones in the first place and want to protect them. But again, every person has a different dynamic, but good point. Susan, what contact information would you like? Do you want them to go to your blog or?
Yeah, go to my blog, myalzheimersstory.com. There's about close to 700 pages on the blog now. So there's a lot of information there. And also I have a Facebook page called Alzheimer's and Dementia Awareness Now. Thank you.
Thank you so much for taking the time to be with us. Holly, I'm going to let you go ahead and wrap up with any last comments and your contact information as well.
Sure. And I am in absolute agreement with you, Susan. I do believe first and foremost family is important and more important in this type of setting. I think we've just recognized the depletion of the PPE being available, and the people that are on staff who have to be there every single day are running into the issues where they don't even have sometimes what they need available. And so it becomes this kind of like, you know, do we try to police family members coming in and out, and do we, you know, try to enforce things that we can't always see? You know, there's a lot of things that go along with that. And so I'm absolutely for family members being there. It's certainly not my intent to suggest that, you know, there should be anything less than that. I think it just came down to, similar to the hospitals, there was only so much that could be done, and everyone was scrambling at the very last minute to figure out this new epidemic that has, you know, changed all of our lives, and how do we safeguard the people that have been entrusted in our care. And so I do hope things open back up as soon as they possibly can, so that family members can be back in place where they belong, seeing their family members. But that being said, I think it's just a transition that we've had to pivot so quickly that people have tried to make the best guess around what strategy will work. And you're right, until we have enough time to look backward at this and actually measure everything, we won't know until, you know, how to handle the next pandemic until we've, you know, totally made it through this one. So I appreciate your comments, and there's definitely nothing on my side that would negate what you said. But that being said, we are HealthStar Home Health. We are in Minnesota, New Mexico, and in Arizona. Out of the New Mexico and Arizona locations, we operate as Circle of Life Home Care. And if you want to reach out to us, you can go to our page. Our webpage is healthstarhomehealth.net. And then you can get to all of our locations that way. And if you want to reach us by phone, you can call us at 651-633-7300.
Wonderful. Well, thank you as well, Holly, for joining us today. I just thought this was a great conversation, really eye-opener. So I value everything that all of you are doing for our communities, for our elders, and those living with dementia and their families. So thank you.
Yep. Thank you.
So in wrapping up, I just want to thank everyone for listening and watching, whichever mode you are taking this all in. Please feel free to like, click, and share this with others. You can always reach me at alzheimersspeaks.com. That's Alzheimer's, plural, and then speaks, plural.com. There you'll be able to find out about all of our other projects and initiatives. Until next time, be safe, stay healthy. Bye now.